So now let's discuss about the process of metastasis. As I told you before, the primary tumor in the original site, let's say we have a breast cancer, the primary tumor in the breast is usually not the cause of death for the patient. So that primary tumor, by definition, is the area of cancer cells at the originating site. So it becomes forming tumor, and once it becomes several millimeters, it's clinically detectable by if it's outside or even inside by taking picture imaging of such as an MRI. So let's look at this cartoon. Let's say if some cells turned their proliferation program into tumorous form that we call as a primary tumor. And once they grow over the size of the diffusion limit, they start to recruit a nearby vessel to form a new vessel that we call as an angiogenesis. And by the time this happens, and that tumor cells, and usually arising from epithelial tissue, which are firmly based on the basement membrane, and when it's usually programmed that it detaches from its original, it's supposed to die. But that's not the case for cancer. So they detach and they invade to the neighboring tissue, especially like when it become a problem when they reach out to the nearby blood vessels or lymphatic vessels, so that when it comes out of the vessel, from the blood clotting, the traveling clot we call as an embolus. So we can kind of call it as a tumor embolism and enter into the circulation. And what happens when the tumor cells inside the blood, then the heart will pump it out. The first thing to go into is its lungs. So it can lodge arrest in organs in lung. And in lung, the cells may adhere to the vessel wall and ooze out, crawl out of the vessel into the tissue. And that process we call as a extravasation. On the other hand, the other part of this, from the tissue to getting into the vessel, we call intravasation. So then the cells will have to survive in this new microenvironment and proliferate, and of course it requires angiogenesis to form a big tumor. And that new colony of the tumor formation in distant organ we call as a metastasis. And metastatic tumors undergo this almost like triathlon-like difficult hurdles because it has to adapt itself to different microenvironment inside the blood, and it has to crawl out. So it is likely to be more resistant and more aggressive types of the cells. So because of that, metastatic tumors are much harder to treat to the conventional therapies, such as even chemotherapy. It's more difficult to treat. That become a problem. So that's why metastasis is responsible for the majority of solid tumor death. So, or we call it as a secondary tumor when the cancer cells acquire the ability to penetrate and infiltrate surrounding normal tissue and spread and growth in the distant area. So with this, we'll discuss about now next time cancer screening and diagnosis. Thank you for your attention.